Hello, Las Vegas, and welcome to Fertility Thursdays with NFI. I'm Dr. Cindy Duke, Medical Director and Physician here at the Nevada Fertility Institute. Today, we're talking about egg freezing and what it means to have a biological clock. First, I just wanted to say thank you, though, to everyone tuning in tonight and to the amazing show of support that we've been having from you, our customers, clients, and fellow Las Vegas citizens. So today we're talking about the biological clock, and I know it's the dreaded clock, right? I mean, as women, the one thing we don't like hearing and certainly don't want to think about is that we have a biological clock. But we do, in the sense that, as you've probably heard me say before, we're born with all of our eggs. So in the context of women speaking about fertility, we do not make new eggs during the course of our lifetime. Instead, we're born with all of our eggs. So the average woman at birth probably has about 4 million eggs or so when we're born. And then as we age throughout the course of our lifetime, we continue to have that number of eggs deplete or diminish, and it continues to decrease until ultimately we have no more eggs left, and we enter that second stage of our life in terms of reproduction, which is called menopause. And we've all heard about menopause or the change, and that's really all related to whether or not you have eggs. So as a woman ages, the number of eggs she's born with continues to decrease. Certainly, by the time we're 30 years old, about 90% of the eggs that we were born with have been depleted. And by the time you're 40 years old, about 97% of those eggs have been depleted. And for the average American woman, somewhere around age 51 to 52, all of our eggs are depleted, and thus we enter menopause. So that's the average age of menopause here in the United States, 51 to 52. That is, in fact, the end of sort of that egg lifespan for a woman. Now, the other thing to know is, as we've talked about before, not only are you born with all of your eggs, but with that comes the other obvious factor, which is that your eggs age with you. So a woman who is 40, her eggs are also 40 years old. And that's important to remember, because despite everything we've done so far with really great diet, being able to be more healthy and active at older ages, certainly today in 2017, the average 40-year-old woman is nothing like the average 40-year-old woman of, say, 30 years ago. But we have to remember that despite all those advances that we've made in our health, in how well we eat, how well we care for our body, our skin, our lifestyle, the eggs are still that age. And with age comes decreased potential of those eggs to yield a live-born baby. So what that means is, as we age, not only do our number of eggs, i.e. the quantity of eggs, decrease, but the quality of the eggs decrease, meaning the ability for those eggs to successfully be fertilized, for them to successfully yield an embryo that in turn yields a fetus, which in turn yields a healthy live-born baby. So the nice thing that has happened recently in the last 4 to 5 years is women now have the opportunity to sort of pause that clock, pause that aging of the eggs. And that is in the way by freezing your eggs, or egg freezing, or oocyte freezing. And the way egg freezing works, the key thing I want people to remember today is it is an elective procedure, meaning it's a procedure that one does by choice. It is a procedure that is fairly straightforward. It is now considered standard of care in the sense that the technology used for freezing eggs is now standard of care. It is not experimental, it is not uncertain, and it's available, widely available. So who should consider freezing their eggs? Well, like I said, women who are aging and perhaps would like to maintain that potential for becoming a mother, of a biological parent to a child in the future, should consider freezing their eggs. Certainly nowadays, we have a number of other things going on in our lives. Women are getting married at later times in their lives. Some people, though they're married, they're delaying fertility for other reasons, career, education, just not the right time yet. For some folks, it's a combination of all those factors. For some folks, it's whether or not, I'd like to have a child now, or I just want to get a few more things in place. And that's all perfectly reasonable. The only thing to know is that biology does not wait. Your body will continue its aging process, and with that, it will continue the aging of the eggs. So how does egg freezing work? Well, the basics are, if a woman is considering freezing her eggs or wondering whether or not she might need to consider freezing her eggs, the first step is to start with a consultation with a reproductive endocrinology and infertility specialists. This, of course, is not really an appointment for infertility, but it's an appointment to preserve future fertility, have the option to preserve your fertility in the future. At that appointment, the doctor will take a history. They will usually do a special test to check how many eggs you potentially have, because we do have tests that we can do to assess how many potential eggs you have. They will also assess your health history and sort of talk to you about your goals in terms of, okay, am I looking to freeze eggs, or am I in a relationship and just planning to delay fertility for a short while? What's the time frame here? In terms of how long it takes, once you've decided, if you decide, I'd like to freeze my eggs, the procedure from start to finish in terms of the decision, figuring out how to afford it, figuring out timing and logistics, somewhere between 2 to 6 weeks, it's all done within that time frame. The typical question that some women ask is, am I too old to freeze my eggs? The short answer is there's no finite age at which you can or should not freeze your eggs. As a matter of fact, some recommendations would be that you consider freezing your eggs somewhere between your late 20s into your 30s, but there are women who've frozen their eggs in their 40s. It really is individual. It depends on your goals. It depends on how many eggs your doctor thinks you may be able to freeze. It depends on how your ovaries are performing. So it's very individual, meaning it couldn't be determined over the phone alone. It couldn't be determined by one blood test, but it's determined by a number of factors. The biggest factor being how you actually respond to the egg freezing stimulation process, i.e. the medications that are used to try to get as many eggs as possible. So again, age, there's no upper limit, but the younger you are, the better the chances though, in terms of the quality of those eggs, for using them to achieve pregnancy and to deliver a live-born baby. So with that said, then the next question is, how long can they stay frozen for? And the short answer actually is in perpetuity, meaning eggs can stay frozen forever. So if you froze your eggs now, you stop the clock, meaning the eggs, if you use them in the future, are now as old as they were when they were frozen. They stay frozen until you need to use them. So for example, if you froze your eggs at 28, but finally decide to become a mom at 40 and chose to thaw those eggs at age 40, then while you're 40 and getting pregnant at 40 with your eggs, you're using 28-year-old eggs of yours. So that is how you can really stop that clock and change the outcome and the numbers in terms of success, chance of delivering a live-born baby at 40 versus what it would be if you were using eggs at 40 that were 40 years old. Very different. So those are the big things I like to tell people about egg freezing. There are lots of other nuances, lots of other considerations. It's actually, though, the take-home points that I want everyone to know is that, one, Egg freezing is now standard of care. It is not experimental. It is actually quite affordable, and there are lots of different ways to afford egg freezing. Egg freezing in the context of someone who wants to stop the clock but is otherwise healthy is considered elective egg freezing. There are other medical scenarios where egg freezing is considered a medical necessity. Those are in cases of people, for example, those diagnosed with cancer prior to undergoing certain chemotherapies and certain other therapies such as radiation, where again one may be recommended for egg freezing. But the first thing to know is that it's standard of care. It is not experimental. It is well established. There are very well developed protocols. The second step in considering egg freezing when one is thinking of doing it is to ask some basic questions. So while your doctor will ask many questions of you, there are certain questions that you should also ask of your doctor in their clinic, which is, how many of these have you done before? How many of these has your embryologist performed? The embryologist is the person who will actually perform the egg freezing. So your doctor will do medication, treatments, ultrasounds, monitoring, but ultimately, once the eggs are taken out from your ovaries, the embryologist is the person who will freeze the eggs and who ultimately would also thaw the eggs when you need to use them. So I like to counsel people that you want to do some of your own homework, which is, how many of these have you done before? More importantly, once you have frozen the eggs, how many of these have you successfully thawed? How many eggs has your embryologist successfully thawed, fertilized, created embryos, got someone pregnant, and ultimately yielded a baby, right? And that's the end all be all of the goal of freezing your eggs, is to improve your chances later on for a live born baby. So while no one will be able to tell you it's 100%, because the truth is in reproduction, nothing is 100%, but you are expecting to hear that they've had successes and that their success numbers are quite good. So these are parameters that you, as the person going in to talk to someone about freezing your eggs, that's what you should ask. So I hope everyone remembers that. Otherwise, again, I just want people to remember it's standard of care. It's not experimental. It's quite affordable. It is recommended for anyone considering delaying fertility, or anyone who is not yet sure but would like to have that option open to them later on in their life, to consider freezing your eggs. And we can do it for someone as young as someone in their 20s in terms of elective freezing, and for someone even in their 40s. There's no upper limit, there's no lower limit per se. In terms of medical indications, because we also recommend considering egg freezing if you are faced with certain diagnoses and are pending certain treatments that we know can affect or damage your ovaries or eggs, then the age limits really aren't necessarily there. They're individual, and it depends on your individual medical need. Okay, so that's mostly what I wanted to talk about today. This topic could go on for sure, but those are the salient points that I wanted everyone to know about, which is that egg freezing is possible. We still do have a biological clock in the context of women, and egg freezing is safe. It's technology-wise standard of care, and it's affordable and available here in Las Vegas. Certainly here at the Nevada Fertility Institute, we offer egg freezing, and our clinic is very experienced in terms of our embryologist, and she has, in terms of those questions I've mentioned, she has the ability to achieve all those in terms of yeses. Okay, so let's open it up to questions. Oh wow, so Facebook just said we have done our 10th broadcast here at the Nevada Fertility Institute, so that's great. Okay, so one question that we have here asks, how soon can I get started? Well, the first thing that I would say is come on in for a consultation. Here at the Nevada Fertility Institute, we make consultations very affordable. Certainly we'll put up the link to our consultations, but it's very straightforward. You can either call us or you can click on this link to schedule a consultation. During that time, we will go ahead and get information from you at that visit. We will order some of those tests that we have mentioned so that we can assess where you are. Once we get going from there, then it all depends on what your final decision is. Again, the decision to freeze one's eggs is an elective process in that you make the decision. So we would provide you with all the information, provide you with how we can help streamline the process for you. But ultimately, it's a decision that's made by the patient and or her spouse, family, or significant other. Okay, let's look through again. Okay, so the other question that's asked is, what if I don't choose to use my eggs? Now, that's a question, again, egg freezing, it's almost like a savings, right? It's like you're saving up for that rainy day, with the rainy day being the possibility of wanting to have children later on in life, when typically your egg numbers are lower, when typically the chance for success of delivering a live-born baby are lower. By freezing your eggs, you have now shortened the possibility of that not happening. So how long can you keep them frozen for? In perpetuity, like I say. Certainly here, women can choose to freeze their eggs for as long as they choose. Really, there's no hard and fast rule, and you would not find a hard and fast rule anywhere. It's all dependent on the patient, her situation, her circumstance, and whether or not she chooses to follow through and become a mom. That is, again, something by choice. Of course, there are many ways to become a mother. This is one way, which is freezing your eggs so that you have the option later on. Well, guys, I want to thank you all so much for joining us tonight. We will be back going forward every 2 weeks, so every 2 Thursdays. We are back to our usual schedule of Fertility Thursdays with NFI. In a couple weeks, we will be talking about genetic testing and when one might want to consider doing genetic testing and how that works in terms of pregnancy, in vitro fertilization, or if you have a known genetic disease that you'd like to screen for. We'll talk about all that then. Certainly going forward, we will have a few promotions related to Fertility Thursday, so do please stay tuned. Some of those promotions will include things like free consultation or some free testing. Stay tuned, keep checking in with us. We'll be more than happy to field your questions. Continue sending us your questions by email. We're always happy to get those. Or you can also send us your questions via Facebook Messenger here on the page. Until then, see you guys. Thank you so much for the support. Come visit us sometime. Bye-bye.